Hi, my name's Cindy Farr, and I'm the Incident Commander for the Missoula City County Health Department COVID-19 response. This is my daily briefing, and today is Wednesday, March 25th. The number of cases in Missoula County is now at 6. There are other areas of the state that are also starting to see a lot of increases. Gallatin County has the most numbers in the state, and they are at 19 cases. Couple of things for our briefing today. If you are in a workplace or organization that has not taken any preventative measures, please do so now. Find other ways to deliver services by online platforms, using telephone or email when possible. It's important to cancel all non-essential meetings and all work travel. Hold meetings of greater than 10 people virtually, and try to provide at least 6 feet of spacing between coworkers during meetings and in-office work areas. It's important to disinfect shared areas more frequently with the EPA-approved disinfectant, and try to review your sick leave policies and encourage employees with illness to stay home. You can probably see that my background is a little bit different today than what you've seen in the past. I'm still fighting this little cold, and so I'm working from home today. Again, whenever it's possible, encourage or allow people to work from home. Keeping in mind that by protecting the health of your workforce, you are also protecting the health of our community and the viability of your business. We're just trying to really get people to implement all of the social distancing measures that we possibly can in order to reduce not only the spread of COVID-19, but other illnesses such as the flu, because if it spreads through your organization, you just may end up with more people absent from work than if you had taken the precautions earlier. So if you haven't taken these precautions, now is definitely the time to do that. We've had a lot of people wanting to volunteer to help out in our COVID-19 effort. Missoula is such a great place for that. We are really civic-minded here, and everybody wants to do what they can to pitch in and help. So we just have a few things that we want to touch on when we're talking about that, and things that we just want people to keep in mind. So we've had a lot of people making masks at home for hospitals. People are making and distributing food from their homes, and also people organizing outreach events. We super appreciate the civic mindedness of our Missoula community, but before volunteering, we want you to keep these few things in mind. So one, before you start making masks or rounding up anything for the hospitals, it's super important that you check with the hospitals to see what they actually need and how best you might be able to get it to them. Right now, neither of our hospitals is taking homemade masks. They may ask for them in the future for patient use, but right now there's just not a need for it. So please do not, especially if you are a high-risk individual, venture out into crowded stores to get supplies and then convene with your friends to make masks. If you do have some on hand, and you want to donate them, there are definitely hospitals around the country that are in much dire need for those kind of things right now. So I would encourage you to just Google it, find out who has a need for it, and put it in the mail to them. One thing that we do know that our hospitals do need right now are blood donations. The Red Cross had to cancel a lot of their larger blood donation events just because of the spread of COVID-19 and trying to implement those social distancing measures. So one thing that you can do to help is contact the Red Cross and set up an appointment so that you can safely donate blood. That would be a great help at this time. The other thing that we just want to remind people is that we really don't want a foodborne illness outbreak on top of what we're seeing with COVID-19. So please don't make food in your home to distribute to the public. If you want to feed people in the community, there are definitely ways that you can safely do that. We would encourage you to connect with an organization that's making meals or delivering meals to people. And if you have additional questions about that, you can contact our food safety experts at 406-258-4755. We also want to ensure that you protect yourself as a volunteer and the people that you are trying to help. So do not volunteer if you're sick. Don't go into homes with sick people or people who are quarantined. Make sure that you wash your hands between different tasks, between touching different surfaces or different home visits. Stay connected with your volunteer organizations and follow any additional protocols or precautions that they line out for you. So we love Missoula and its civic-mindedness, and I know that we can get through this together. We just don't want well-intended members of our community putting themselves in harm's way or bringing in unintentional consequences. So we've had some questions about quarantine and isolation, and so I just want to touch on that briefly. What does that mean if you are asked to quarantine or isolate? So quarantine is where you have maybe been exposed to a case of COVID-19, or you've traveled to an area where they're experiencing community-wide spread. And in order to protect people in the public from being exposed, then we ask you to quarantine yourself at home for the incubation period of 14 days to see if you're going to actually develop the disease within that incubation period time. So when we ask you to quarantine, what we're asking you to do is stay home. Don't go anywhere. I know a lot of people are like, oh, but I still need to go get groceries, or I still need to get my medications, or those kind of things. So there's other options for that. If you're being asked to quarantine by the health department and you have concerns about that, certainly talk to the public health nurse that talks to you. But some of the things that you can do is enlist a family member or a friend to go and pick up your medications and leave them at your front door, or to go out and get your groceries for you and to leave those at your front door. You should not be leaving your house for any reason, and you should also not be having anyone come into your house for any reason other than emergency health care. So if you were in isolation because you have the disease, or you are in quarantine because you're trying to wait out that 14-day incubation period, and you have an emergent health care need, then that is the only time that you should have people coming into your home, is to help you with that. And in that case, you just need to call 911 and let them know that the first responders need to use precautions when they come to your house. So I hope that clears up what quarantine and isolation is. Quarantine is for the 14-day incubation period to determine if you're going to develop the disease. Isolation is for after you already have the disease and you need to isolate until you are no longer contagious to other people. And that is one of the big measures that's going to help us keep from spreading this disease, is that when someone is in contact with the disease, that they stay home and don't allow other people into your house. And if you have the disease, same, stay home and don't allow other people into your house. All right, I think that's it for my daily briefing. So with that, thank you, Missoula, for everything that you're doing out there to help keep our community safe and stay healthy. And I'll talk to you tomorrow.